Capitol time, you see, they're running out. Congress deeply divided, and if a deal to fund the government isn't reached by the end of the week, you could feel the effects of that. A federal government shutdown will also, though, impact one of North Carolina's largest state agencies, the Department of Health and Human Services, which is responsible for ensuring our health, our safety, and our well-being. DHHS Secretary Kody Kinsley explained to me what could happen if a government shutdown happens.
Unfortunately, in 2013, which was the last federal government shutdown that was similar to the kind of shutdown we may see on October 1st, unfortunately the Department of Health and Human Services had to furlough 5,000 staff, either part or full-time. That's a major concern because those are staff that provide critical services to the people of North Carolina, whether that's our women, infant, and children's food program, or providing early education support for our child care centers and a number of other things.
And just so I'm clear, with these people who you're talking about being furloughed, they get federal paychecks, but they work through the state?
Several thousand people at the Department of Health and Human Services work on programs that are federal programs. And so their costs as staff are paid for by the federal government. They are state employees, but they are federally funded. Roughly 80% of the North Carolina Department of Health and Human Services budget is funded by the federal government. Only 20% is actually state dollars. And so that either impacts staff in certain ways or impacts the programs that we operate.
Does that trickle down to the county level then too?
Absolutely. It'll impact our county governments, our departments of social services, our local health departments.
If you rely on one of these services, is there something I should be doing right now to kind of be ready for this?
You know, right now there's nothing specific that individuals should do. We're working closely with the federal government. They're still determining guidance. They'll pick program by program exactly what the impact will be. Meanwhile, we're doing every possible thing we can at the Department of Health and Human Services to prepare, to try to mitigate this negative impact to the people of North Carolina. We're in a pretty strong place because of our fund balances and because of prudent management. I think we're going to be able to smooth over and minimize any disruptions. But I'd rather not be spending the time getting ready and instead spending the time delivering for the people of North Carolina if our friends in D.C. could do their job.
We will see. We'll be watching. The government shutdown again looms this weekend. Coming up next here on Your Side Tonight.